Putnam County has a population of about 36,000.
Unfortunately, Putnam County, one of their claim to fame is we have a high smoking population. COPD, emphysema patients are a large portion of our patient population.
Being a smaller facility, there are fluctuations in that patient population, and anything that can stabilize that inpatient population with the census levels contributes to the overall financial sustainability of the facility. Every spring, with our Board of Trustees and our medical staff leadership, we ask all of the staff, all of the service lines, and all of the various departments what their capital needs may be for the coming year, for 3 years, and for 5 years. We rank those in order of clinical importance and the sustainability and the revenue that they might produce, whether it's a new service line or whether it allows us to keep patients that we otherwise would have transferred.
So we were using pressure ventilation quite a bit. Our pressure ventilation masks and apparatuses were out of date and we needed more of them. One of the respiratory therapists that works at another hospital said people are starting to use Vapotherm. It works well for COPD.
When we evaluated the cost of the therapy, it did seem to be more efficient, especially in our setting.
The Vapotherm with a compressor was probably at least half of the cost, and some of them they were a third of the cost. So it was pretty significant difference. The cost wasn't the only factor.
The second part that we firmly believe during our research and evaluation is that it would allow us to treat patients here on an inpatient basis that otherwise would have been transferred to a tertiary care hospital. And if we don't have the volumes and if we have patient out migration for those types of services, then we don't have the volumes that would contribute to financial sustainability.
A lot of our patients that we place on Vapotherm may turn around very quickly and may not need a lengthy hospital stay on NIPPV therapy in the past or currently on Vapotherm. It's kind of prevented us from maximizing our hospital bed capacity and then forcing us to transfer additional patients to the surrounding community hospitals.
The basic premise in our mission is that we can't be everything to everyone. We're never going to be a transplant hospital. We're not going to do complicated chest surgeries. But those critical needs, the healthcare needs that need to remain in the community, that's what allows a critical access hospital to serve its community best. So we firmly believe that our niche as a provider is providing those necessary services and providing them with a more personal touch with a higher patient satisfaction level than can be provided in the tertiary care hospitals.